Hello friends, today we'll learn about type of neck dissection. So first we'll see what are the information given in the belly, then we'll move on Sabiston, and then we'll go also on Schwartz. So we start with belly. The first one is classical radical neck dissection. This is also known as Cryle because this is given by Cryle. Okay. So we have to remember what all the group of lymph node is removed and what are the structure is removed. So look, whenever you say neck, you just imagine the neck. Okay. So you will find the typically lymph node level 1 to 5 stay in the neck, and the 6 is the anterior group of lymph node and 7 is mediastinal. So leave these two group of lymph node. So any type of neck dissection you will remove. Any type of radical neck dissection you are going to remove 1 to 5. Whenever you heard radical, you think about 1 to 5 group of lymph node. Okay, and since this is the classical radical neck dissection, so you will remove all the non-lymphatic structure present in the neck. So what are the structure present in the neck? There is an internal jugular vein, accessory spinal nerve, submandibular gland, and sternocleidomastoid muscle. Okay, that's it. So the main disability of this classical radical neck dissection is the weakness and dropping of the shoulder due to paralysis. Why paralysis? Because we have cut the spinal accessory nerve, which is supplying to trapezius muscle. Okay, fine. Now come to modified radical neck dissection. I said whenever you heard radical neck dissection means 1 to 5. So now term has been modified. So in modified, if you preserve one or more non-lymphatic structure, the keyword is non-lymphatic structure. Okay. Now come to selective neck dissection. So we further going to select neck. Selective neck dissection, we are going to select the lymph node. So in this, one or more major lymph node group is preserved along with non-lymphatic structure like sternocleidomastoid muscle, accessory spinal, or internal jugular. Okay. And the one important thing, neck dissection after chemoradiation, that operation may not fall into this category. It may be one-liner. Okay. So this much I given in the belly. Now come to Sabiston. So as I have already said, radical neck dissection means 1 to 5 group of lymph node along with non-lymphatic structure like jugular vein, sternocleidomastoid spinal accessory, that is cranial nerve 11. Okay. Whenever the next word is lateral neck dissection. So whenever you heard lateral means think about the 2 to 4 because the 1 is not fall into lateral. Huh? So lateral group of lymph node means 2 to 4. Okay, 2 to 4. And the supraomohyoid dissection. Okay, so supraomohyoid dissection means 1 to 3. How we will remember, I'll say in the next in Schwartz. Okay, so supraomohyoid dissection is 1 to 3. Okay. So radical neck dissection is given by Cryle. This is also been asked. Okay. This already has been discussed. So one more time I want to tell the standard radical neck dissection, same, that is the classic. Remove 1 to 5 sternocleidomastoid, internal jugular vein, cranial nerve 11, and one more structure is given here, classic cervical plexus and submandibular gland. Okay. So the modified radical neck dissection, if you preserve sternocleidomastoid muscle, internal jugular vein, and cranial in any combination. Okay. So modified radical neck dissection is also called Boca neck dissection. This is also been asked. Modified is Boca. Okay. And then when you cut the spinal accessory nerve, lead to trapezius paralysis. This condition is known as painful chronic frozen shoulder. Painful chronic frozen shoulder. So it's painful, huh? Chronic frozen shoulder, okay. As I have said, in selective neck dissection, we are going to preserve any group of lymph nodes from 1 to 5, okay. So oral cavity cancer and the lip cancer mainly goes to 1 to 3, okay. While pharyngeal and laryngeal mostly goes to 2 to 4, okay. And selective neck dissection mainly done for clinically N0 neck, okay. Okay. Now come to Schwartz. Few important points given here. So what Schwartz says, neck dissection. Nowadays, neck dissection only performed when the risk of occult disease more than 20% in clinically negative node. Okay, clinically negative and occult disease more than 20. Okay. So what is selective neck dissection? Where it is done? So already said it is clinically node negative. One more point written here: limited C1 disease will also do selective neck dissection. Supraomoid, see there is a 3 times O, so 1, 2, 3 group of lymph node dissection is done in supraomoid. Okay. One liner is given regarding tongue cancer. If tumor is 4 mm or thicker, having higher rate of occult disease, so 4 mm. Okay. So already said lateral leg dissection. Lateral, when you heard, it is 2 to 4. Okay. It is done for laryngeal and hypopharyngeal cancer. Okay. And posterior lateral, whenever you heard post lateral, so it's 2 to 4. One is posterior, word posterior added in lateral, so 5. So posterior lateral group done is for 2 to 5. Okay. And mainly done for thyroid cancer. So advanced nodal disease, with the exception of uncomplicated N1 disease, modified radical neck dissection is treatment of choice. That's it. Thank you.